Come on. There we go. We're live. Okay. Woo, praise God. Okay. Hi, everyone. This is the voice and the face of Dr. Olabintan. I'm the CEO and co-founder of Livingspring Family Medical Center in the beautiful city of Mansfield, Texas, where we help our patients live long and well because we believe the quality of life is just as important as the quantity of life. I'm excited today to have another conversation in line with what we're about. On the topic, Doc, I quit smoking, but my COPD keeps acting up. Help me. And I'm delighted and excited to have with me as a guest Dr. Shade Farri. How are you doing, doctor? And thank you so much for coming.
Thank you, Dr. Olabintan, for having me. I'm doing well. Thank you.
All right, awesome, awesome. Now, that being said, for those who are watching live, hashtag live, those who are watching replay, hashtag replay. Now, Doc, if you don't mind, can you kindly introduce yourself? Who are you and what do you do?
Sure. Like I said, I'm Shade Farri. I'm a pediatric pulmonologist. That means I take care of lungs. But right from the beginning, we take care of the lungs stay with us throughout our life. So right from premature babies through childhood, all the way to adolescence and adulthood. And one of the things I'm very big about is the fact that lung health, we preserve it through childhood, but with the desire to help us through adult life in preventing diseases and staying healthy. So I'm very much an advocate of lung health, all things lung health, all ages I'm in. So that's how I describe myself.
Spoken like a true pulmonologist. I love it. You're all these lungs. I love it. All right. So curious minds want to know what was it with lungs? Why do you do what you do? Is there a story behind it?
Sure. First of all, why not, right? The lungs are the most important organ in the body. Right?
Not in that
um,
life.
there's a saying I like that says that life and respiration are complementary, that there's nothing that is living that doesn't breathe. It looks different for different organisms, but there's nothing living. And anything breathing is has life. And so that's aside about how life and breath are complementary. But why do I do what I do? There's a story about that. So when I was in high school, we called secondary school in Nigeria,
Hmm.
my grandmother always had a cough. I went to see her very often because she lived with us at some point. She's of blessed memory now, but she always had a cough, and I remember thinking cough um, usually lasts when you have a viral illness, so a few days, and it wouldn't get better. So I remember at some point I brought it to her, and I said, "But you cough all the time," and
Hmm.
so it was much later, and when I got into medical school, when I started learning and I realized that she met criteria. I'm not sure anyone used the term COPD
Hmm.
for her at the time. She had been exposed to biomass fuels all her life, and
Oh, wow.
so one of the things that she battled throughout the end of her life was the impact that um, um, COPD had on her heart and all the other complications. And so it became something that I became very passionate about. Number one, like I said, maintaining lung health, preventing
Mhm.
long-term illness, because many times which we'll get into, many times that bell cannot be unrung when it has been rung. So
Mhm.
so from that standpoint, I became an advocate of educating about things that could be harmful. And then so we start really early. I talk about it when babies are little, but even in adolescence about the risk factors, some lifestyle choices that could harm you. So I'm very big about preventing smoking in young adults.
Mhm.
So those are some of, there are many more stories, but I don't want to get into it. But that right there is one of the reasons I'm very big about preventing, educating on COPD prevention and management.
Awesome, awesome, awesome. Now let's go right into it. We're talking COPD. So real quick, what is COPD real quick? And then maybe the second part of that could be um we know it's tied to smoking, but how come it's still actually let's just start with that's a mouthful. Let's start. What's COPD, Doc?
So COPD is chronic obstructive pulmonary disease. That's just the obstructive disease of the lung. If you think of the lung pipes, airways, and you think of them as a network of pipes, if there's obstruction to the flow, in and outflow of the lung, that's really the core of this disease. And why is because the pipe system is damaged. And so there's a lot of inflammation, there's a lot of mucus production in response to that inflammation, and then there's loss of natural smooth in and outflow of lungs of air from the lungs.
Okay. And we know that one of the common causes of it is smoking. But have you seen in those who actually don't smoke?
Absolutely, yes, you're right. The commonest cause is actually smoking, but there are many other causes. There are some other causes. So, for instance, like I mentioned earlier, exposure to biomass fuels, fires from wood, kerosene, and some other types of fuels that are used. That is one of the causes. Another of the causes could be there's some natural genetic diseases that could. One is alpha one antitrypsin deficiency that could cause it, and so the risk factors are many. So also some people have a lung condition, if not properly, occupational exposures. So occupational diseases, farmers, miners, construction workers, certain exposures over time can also cause COPD. So those are the commonest causes of COPD.
And what I've found also is there's a reason why we have the vent in the house. Some of us are trying to save money. We don't want to turn the vent down. I'm not going to put it on. It's probably sucking a lot of stuff, but that's one of the things that helps, irritation, avoids irritation to your lungs. So it's taking out the soot and the fumes that come from the foods. So very, very important for us to take note of that. So thank you for highlighting that. Now, my next question to you is, why is COPD still acting up, even though, people have quit smoking? For someone who's listening, like, I feel frustrated, I stopped smoking, but I still have flares. Like, why?
So it's because of the damage of the airways that tends to be irreversible at the level. By the time we're diagnosing someone with COPD, the pipe network or the airways, if you think about it, within the lungs are already damaged beyond repair. So I applaud anyone. First of all, the first step in mitigating damage is quitting smoking. So that's something we should applaud. But then there's unfortunately, quitting smoking is not enough. Now, those damaged and inflamed airways will have to be managed. And there's medications we use, there's breathing exercises, there's multiple other things we can do to then manage COPD. But quitting smoking is not enough to cause a reversal of lung function.
Okay, so let's talk about the things that can help. So someone who's watching who's like, all right, fine, I agree. I'm seeing that it's something that to a certain degree is not reversible. But what are things that I can do specifically to help my symptoms? Now, of course, these are medical suggestions. We do recommend that you schedule time with your own doctor to come up with an individualized plan for you. But Doc, what are things that can help?
Absolutely. Yeah. So inhaled medicines tend to be the cornerstone of managing COPD. They're in big groups, like we said, your doctor will prescribe them because two broad categories many times we deploy. One will be the acute relief medications, the bronchodilators that just help increase the size and allow airflow to be improved, because difficult airflow then is shortness of breath is the reason why it's hard to keep up with activities of daily living. There's a second category of medications that are then long-acting bronchodilators, so that they don't give acute immediate relief, but over time they work to just again allow better airflow. When patients are acutely sick, we use steroids, we use antibiotics, oxygen. Some patients, unfortunately, because of how much carbon dioxide is being retained in the lung, we may need to supplement oxygen for them. And like we mentioned, and we'll get into pulmonary rehab, concentrated pulmonary exercises to help strengthen the chest wall muscles to help them make breathing more effective or efficient. So those are usually some of the combination of these are some of the treatment plans we offer.
All right. So I actually, remember it's patients, some of my clients who have had COPD as a result of COPD-like symptoms from COVID, and some haven't gotten back to baseline, and so there maybe someone's watching and said, yes, I did the rehab, but are there other things I can do at home to help increase the chance of me, not afraid not to get worse as quickly as it could be if I didn't do these things?
These things, yeah.
Yes.
So absolutely, like we said, irritants. You had mentioned that. So the lungs are they're very helpful to us usually over time because um, during the natural course of the day, we're exposed to many things that are not. We breathe in many things that don't belong there. So the natural control system, the mucus, traps them, kills them, wraps them around, and gets rid of them. The reason I bring that up is that further exposures. So what are the things we can do around? So one thing is you mentioned air filtration system.
Okay.
So let's take it from the top and say tobacco exposure. So
Okay.
even if you're not a smoker, you want to reduce your secondhand smoke exposure.
Okay.
You want to reduce exposure to dust. So dust mite. So cleaning the house. So if there's carpeting in the house, you want to use a HEPA vacuum. So a vacuum with a HEPA filter as often as possible. It can be challenging, but if removing the carpet is not an option, then
Um,
and preferably the person with COPD should not be the person cleaning, right? But the home needs to be. But
that's a good point. That's a good point.
but if they have to be, then they might want to wear a mask. But absolutely use a vacuum with a HEPA filter. Look for that label because other vacuums actually just stir up the dust mite and all those molecules. Look around the home and make sure there's no mold. Bathrooms, basements, kitchens, and if there is, we should take care of that. The other thing that we want to do is cleaning agents. Many of them have bleach, for instance. Everyone's favorite anti germicidal
Right.
is very caustic, and so the fumes from it can be very injurious to the lungs. So there's many household cleaning agents that we want to minimize exposure to. If and when they have to be used, very diluted, and then we want to improve ventilation. So a good, we want to change our air filters every 6 months to every, as often as we should, depending on where we live. Those are things we can do. And then in terms of what else can we do? So the pulmonary rehab can be intense, meaning for a few weeks at the facility, but over time, breathing exercises should be a part of that person's daily routine. Avoiding exercises worsens COPD. So we may not be able to run a mile, but even if it's a walk down the block, while we're practicing some breathing exercises, it can make a lot of difference.
Wow, you said a whole lot. So I'm glad this is recorded so people can go back and take notes because I'm trying to chat and put it on here, all the things you're saying. But this is very, very helpful. Simple things you can do at home to minimize flares. We're emphasizing prevention here. So this is good. Now, let's talk breathing exercises. Now, you talked about pulmonary rehab. Let's say someone is way past, like, insurance doesn't cover or something. Are there certain exercises that you recommend compared to others?
Absolutely. So there's one, the easiest one is pursed lip breathing. I'll describe it, and then I'll demonstrate it. I don't think I could talk and do it at the same time. But the goal is that we want to slowly breathe in, and we want to breathe in quickly or a normal rate, and then we want to breathe out slowly. That allows us to optimize the intake of oxygen and then allow that carbon dioxide that is retained inside the lung to come out. So the process is and we can repeat it as often. Breathe in through the nose, like a count of 1, 2, and then hold for half a second. And then we want to purse the lips as though we want to blow out a birthday candle, and then let that go over about 4 seconds. So slowly. So I'll practice. I'll do breathe in 1, 2, and then we can repeat. So slowly over 4 to 6 seconds. That, as simple as that is, and can be repeated. And we can do this, like I said, in groups of 10, 20, or during a short exercise, something where we need to manage. We want to help strengthen the breathing muscle, but we also want to make breathing feel like less work for the lungs at that time.
Wow. 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 That's actually also very relaxing. So I'm sure there are multiple.
Yeah, there's multiple advantages. Yes.
To doing that. Wow. This is good. This is good. Now, you talked about HEPA filters. Are there, as long as they're HEPA, no, can't talk. Are there any other purifiers you recommend? Or is it as long as they have the HEPA filters on them that's the type? What makes that? Why is that a big deal?
So that's a high efficiency particulate. So it's just so that the filter, any device that has a HEPA filter.
Okay.
Earlier we mentioned the vacuum with the HEPA filter. Now the idea of it in our home, we're focusing on the indoor environment because we necessarily may not be able to unfortunately control pollution. There's also the risk of that. And so for time, there's particles that have, once they are larger than a certain size, they tend to be more troublesome and more irritating for the lungs. And so the HEPA filter is designed to capture particles that are at a particular size and above. And so that's what that high efficiency. So it's just, now there's a few other ratings. There's something called a MERV rating without getting technical, but HEPA is a common term. And so even the product manufacturers will put it on there that, this has a HEPA filter in it. So it's just a general class of efficiency that the filter has to attain to be useful in reducing particulate matter.
Okay. All right. Awesome. So, Doc, this has been very, very power-packed. A lot of information that can help people breathe well and, of course, improve their quality and quantity of life as well. People are wondering, Doc, they want to connect with you. They want to maybe have you come speak on their platform as well or work with you. Doc, where can people find you?
Oh, thanks for asking. So I'm on LinkedIn. I'm on LinkedIn and follow Shade Farri, and I'm also on Instagram, at Shade Farri. Do I type it in the chat or?
We got you. We'll put it right here.
Okay. Yes. So absolutely. So like I said, I'm happy to talk about all things lungs, all things prevention, all things management of lung diseases, and so yes, that you can find me there.
Yeah, so we're putting the information on the chat group as well, or the comment section. So we have you on Instagram, we have you on LinkedIn, and you're on Twitter, Doc. You're on Twitter.
I am.
You're on Twitter. So we put all of that information there as well. So thank you so much for taking time out of your busy day to do this with us. We appreciate you. I typically ask my guests that they should please come back in 6 months. I ask them live, so they can't really say no. But I would love to have you on again 6 months, let's say from now, to talk something related to lungs. Okay?
Absolutely. Thank you.
Oh, my pleasure. All right. Thank you all for watching. Those of you who are watching in live and those who are watching replay, please share this with those who could find this useful. You never know who this could bless or help improve their quality of life or give them hope, even as they are concerned about their breathing, where COPD is concerned. You can always forward this to them. You can also put their names in a comment and tag them as well. But I appreciate you for watching and hanging out with us. And if you or anyone you know is looking for an awesome AFAR and a passionate family physician who will have conversations to help you live long and well, I am she. Have a good one. And thank you so much, Doc. I appreciate you.
Bye. Thank you.